Welcome back guys. Now in this video let's continue with the topic of oxygen hemoglobin association dissociation curve. Okay. See, in the previous videos we have discussed about this concept. Already you know about this concept. What is that? Whenever the partial pressure is more, okay, whenever the partial pressure of oxygen is more, there is going to be more association, which means hemoglobin will love to bind with the oxygen. Hemoglobin accepts the oxygen. So more partial pressure, more association. And whenever the partial pressure decreases, we all know whenever the partial pressure decreases at the level of tissues, what will happen? There is going to be more dissociation. Dissociation means what? Hemoglobin will release the oxygen molecules. So more the partial pressure, more association, less the partial pressure, more will be the dissociation. We already know about this concept. So with this concept in mind, let's discuss about the oxygen hemoglobin association dissociation curves. Okay. So here what you are seeing is the oxygen hemoglobin association and dissociation curves, guys. See, three curves are there. The curve which I am highlighting in the center, this curve which I am highlighting here in the red color, that's normal. Okay, normal oxygen hemoglobin curve. Now this green color curve, okay, this green color dotted line, whatever I am showing, it's a right shifted curve, and on the opposite side, this curve which I am highlighting right now, it's a left shifted curve, which means sometimes the oxygen hemoglobin curves will shift towards the right side, sometimes they will shift towards left side. Okay. Now first of all, let's see what is normal. Later we will discuss about the conditions which are going to favor the right shift and the conditions which favors the left shift. Okay. First look at the graph. Whenever you are looking at a graph, always you have to first check what is given on the x-axis and y-axis. See, on the x-axis what is given? It is the partial pressure. Okay, partial pressure. On the y-axis we are talking about the hemoglobin saturation. Okay, so we are looking at the relationship between the partial pressure and hemoglobin saturation, and we already know that whenever there is going to be the more partial pressure, whenever partial pressure is more, hemoglobin saturation will be automatically more. More the partial pressure, more saturation of the hemoglobin or more association is going to happen, right? So what is normal? Have I already taught you that whenever the partial pressure is 100 in the arterial blood, okay, in the arterial blood when the partial pressure of the oxygen is 100, so let's round up here. Okay, when the partial pressure of oxygen is 100, how much will be the hemoglobin saturation? All four molecules will be occupied, all four oxygen molecules will be occupied. So that is what I am showing you here. So whenever the partial pressure of oxygen is 100, how much is the hemoglobin saturation? Hemoglobin saturation is also 100. More the partial pressure, more saturation. Next step, what we have seen at the level of tissue. See, at the level of tissues in a deoxygenated blood, okay, when the blood is becoming deoxygenated, you tell me in the deoxygenated blood what is the partial pressure of oxygen? The partial pressure of oxygen in the deoxygenated blood is 40, right? It's 40. So when the partial pressure of oxygen is 40, how much will be the hemoglobin saturation? Hemoglobin saturation, look at here. Hemoglobin saturation is how much? Hemoglobin saturation is 75% saturated, which means one molecule of oxygen is released to the tissues because it's a venous blood, no? So in venous blood, hemoglobin is carrying only 3 molecules of oxygen. So one molecule released to the tissue. So 75% saturated. So finally the statement which I am trying to give here, see, I am taking two lines. Okay. In the arterial blood, when the partial pressure of oxygen is 100, when the partial pressure of oxygen is 100, hemoglobin is how much percent saturated? 100% saturated. In the venous blood, when the partial pressure of oxygen is 40, how much the hemoglobin saturation? Hemoglobin saturation is only 75%. So higher the partial pressure, higher saturation. Whenever partial pressure is decreasing, see, from 100 to 40, when you decrease the partial pressure from 100 to 40, hemoglobin is getting desaturated, becoming 75% saturated, from 100 to 75% saturated. Okay, you all know this. So in this curve, see, higher the partial pressure, higher the saturation. When you are decreasing the partial pressure, what is happening to the saturation? See, the saturation is also decreasing. Okay. Next, if you understand this, now let's look at what is this right shift and what is left shift. In which conditions you can have this right shift and the conditions where there is going to be left shift. Okay. So look at this table. Guys, in this table, here, first we are discussing about right shift. Right shift is an example of low affinity state. Low affinity state. What does I mean by the word low affinity? I will explain. See, let's say something like this. Imagine the person is doing exercise, let's say he is jogging, he is going on a marathon race, he is doing a lot of physical activity. Whenever a person is doing exercise, what will happen to the level of oxygen in this person? Automatically decreases, because he is working more and more, he is using up more and more oxygen. So, there will be a hypoxic condition at the level of tissues. So, hypoxia in the body, and whenever you are doing more and more exercise, more carbon dioxide will be produced. If you are using more of your muscles, more metabolism is happening and you automatically produce more carbon dioxide. So, there is going to be hypercapnia. So, there is hypercapnia and hypoxic condition during exercise. And we all know during exercise what happened to your body temperature? Your body temperature increases. Next, we know the biochemistry, whenever you are doing the exercise, what happened to the acid production? The acids are going to be more. Whenever you are doing strenuous exercise, lot of exercise, you are going to have anaerobic metabolism, and anaerobic metabolism is going to produce a lactic acid. So, this lactic acid is going to cause the acidosis, lactic acidosis. So, what will happen to your pH? Your pH decreases, more H plus is going to be produced, more acids are going to be produced. So, what I am trying to say, guys, see, whenever you are doing exercise, okay, whenever your muscles are working more and more, what kind of environment is generated in the body? So, there is going to be hypoxia, hypocapnia, acidosis, low pH, more protons, more body temperature is going to be there, and during exercising conditions, there is production of this 2,3-bisphosphoglycerate or 2,3-diphosphoglycerate, okay. So, the production of this molecule is going to be there in the RBC. RBCs are going to produce more 2,3-BPG, okay. Now, see, this environment, what kind of environment? See, whenever there is more metabolism, so this environment is there in your body, okay. This environment like low pH, more acids, more body temperature, hypercapnia, okay. This environment is going to influence the hemoglobin. This environment is going to bring the changes in the nature of the hemoglobin. How, sir? Let me ask you one simple question, you tell me. So, whenever muscles are working more in this condition, your muscles require more oxygen or less oxygen, you tell me? They require more oxygen. Now, the muscles are asking for more oxygen. We want more oxygen. We want more oxygen. See, when the muscles are asking for more oxygen, what do you think the hemoglobin will do? Hemoglobin will say, you muscles, you are working more. You require more oxygen? Yes. So, I will give you more oxygen. So, hemoglobin, do you know what now it will do? Instead of giving one molecule of oxygen to the muscles, usually hemoglobin, every time it is releasing how many molecules of oxygen? It is only releasing one molecule of oxygen, right? Out of the 4 molecules it is carrying, every time it is releasing one molecule of oxygen to the tissues. But right now, whenever such a condition is there in the body, whenever such a environment is there in the body, now hemoglobin will start to release 2 molecules of oxygen. Hemoglobin is releasing more molecules of oxygen. Why? Because the tissues are working more. More they work, more the hemoglobin have to release. Okay. So, that is what is called as right shift. So, look at the right shifted curve. Right shift. So, this is the green color curve, right? Right shift. Now, look at the level of tissue, see, in the venous blood. Okay, look at the venous blood, 40 point. In a normal person, whenever the partial pressure of oxygen is 40, okay, whenever the partial pressure of oxygen is 40, hemoglobin is how much percent saturated? Hemoglobin is 75% saturated. But look at the right shifted curve. See, in a right shifted curve, hemoglobin is how much percent saturated? Hemoglobin is only 50% saturated, which means the hemoglobin molecule is something like this. See, imagine this is the hemoglobin molecule. Okay, it's only 50% saturated, which means only it is carrying 2 molecules of oxygen. Then what about the other 2 molecules? The other 2 molecules release it to the tissues. The other 2 molecules of oxygen release it to the tissues. So, instead of releasing 1 molecule of oxygen to the tissues, now hemoglobin is releasing 2 molecules of oxygen to the tissues. Okay. So, more dissociation, more oxygen delivery. So, that is also called as Bohr's effect, right? Bohr's effect. So, right shift means what? Right shift means Bohr's effect. Right shift is nothing but the release of oxygen to the tissues. So, from today, you should say Bohr's effect means what? It is the release of oxygen to the tissues. Why? I have told you one reason. Whenever the partial pressure of oxygen decreases, hemoglobin will release the oxygen. Not only that, whenever there is more temperature at the level of tissues, whenever there is more temperature, more carbon dioxide production, hypoxic conditions, 2,3-bisphosphoglycerate and low pH, all of them, they will favor the oxygen delivery to the tissues. Whoever favors the oxygen delivery to the tissues, that is called as Bohr's effect. Bohr's effect means release of oxygen to the tissues. Now you understand? So, whenever your tissues are working more, hemoglobin is a very generous guy. Okay, hemoglobin will say, you want more oxygen? Okay, take more oxygen, no problem. I will give you more oxygen. You work more, I will give you more. Something like that. Okay, done with this. Right shift completed. for your exam, okay, it doesn't matter NEET PG exam or FMG exam, this is going to be the most important topic in the respiratory system. The conditions where right shift is going to occur and the conditions where left shift is going to occur. Now, why we are calling it as a low affinity state? Now you understand low affinity means hemoglobin is now not tightly binding with the oxygen. Hemoglobin, it is not tightly binding with the oxygen, it is rather it is releasing the oxygen. Okay, it's oxygen to go to the tissues. Oxygen, you please go to the tissues because tissues want you more now. So low affinity. Hemoglobin is not loving the oxygen, rather hemoglobin is releasing the oxygen. So low affinity state. Low affinity, what is the meaning? Low affinity state meaning more oxygen delivered to tissues. Okay, more oxygen is delivered to the tissues. Now, in the same way, let's look at the left shift. What exactly is left shift? Left shift is an example of high affinity state. Why? Okay, and which conditions we are going to have the left shift? See, whenever there is less metabolism in a person, less metabolism. Let's say a patient is in coma, guys. Okay, let's say a patient is in coma, he is having less metabolism, his muscles are not working. Okay, his muscles are not working, he is having less metabolism. Now you tell me, whenever he is in coma or whenever there is less metabolism, what about the oxygen demand? He requires more oxygen, his tissues require more oxygen or less oxygen? Definitely less oxygen. The tissues are not asking for the oxygen. So, whenever there is less metabolism in the body, there is going to be low temperature in the body. He is not producing acids, so he will go into alkalosis. Okay, less proton production, less carbon dioxide production. So, what I am trying to say, whenever there is low metabolism, what kind of environment is generated in the body? There is going to be less carbon dioxide production, there is going to be high pH, low protons, alkalosis is going to be there, low body temperature. All of them they will influence the hemoglobin structure in such a way. Normally hemoglobin will release one molecule of oxygen to the tissues. Okay, normally one molecule of oxygen is going to be released to the tissues every time in a normal person. But now look what happens in left shift. Guys, concentrate here. This brown color line is the left shifted curve. Let's say in a normal person, when the partial pressure of oxygen is 40, okay, in the venous blood, see how much is the hemoglobin saturation? Hemoglobin saturation is 75%. In a right shifted curve, hemoglobin saturation is 50%. But in a left shifted curve, hemoglobin saturation is more than 90%. Means hemoglobin is highly saturated. Okay, even in the venous blood, think, even in the venous blood, hemoglobin is highly saturated, which means is it releasing the oxygen to the tissues? No, it is not releasing the oxygen to the tissues. Okay, it's not releasing oxygen to the tissues. It's highly saturated. Why? Why it is not releasing the oxygen to the tissues? Because tissues doesn't want the oxygen now because they are not working more. Okay, so hemoglobin saturation is not decreasing. Yeah, decreased, but only 100 to 90. Hemoglobin is, the saturation of the hemoglobin is decreasing very slightly. Okay, which means hemoglobin is tightly binding with oxygen. So that's why it's an example of high affinity state. Tissues, you work more, I will give you more oxygen. If the tissues are not working, hemoglobin will say you are not working. Why? What is the point of me giving oxygen to you? What is the point of giving oxygen to you? Because oxygen can lead to the generation of free radicals, reactive oxygen species. Okay, oxygen is good but equally bad. So whatever the demand, that much oxygen should be delivered. If more the demand, more should be delivered. Less the demand, less oxygen should be delivered. Simple. Okay, business is simple. More you want, I will give you more. If you don't want, I won't give you. So hemoglobin behaves like that. So that is an example of what? That's an example of left shift. Less metabolism in the body, left shift. More metabolism in the body, right shift. Okay, now we understood. So yes, left shift is an example of what? It's a high affinity state. High affinity, what is the meaning of the word high affinity? Less oxygen delivered to tissues. Okay, less oxygen delivered to the tissues. That's the example of left shift. Okay, not only that, one more important point which I want you to know is, guys, there is fetal hemoglobins. Okay, fetal hemoglobin which is made up of alpha 2, gamma 2 chains. Normally in adult hemoglobin there is alpha 2, beta 2 chains, right? Fetal hemoglobin have these gamma chains. So these fetal hemoglobin, okay, the fetal hemoglobin, let's say HbF, fetal hemoglobin, it has very high affinity. It will tightly bind with oxygen, it will never leave the oxygen easily. Okay, it's have very high affinity for the oxygen. So fetal hemoglobin is also having high affinity. So fetal hemoglobin also shows left shift. What is the meaning of the word left shift? Left shift means high affinity state. So fetal hemoglobin have very high affinity for this oxygen binding. So yes, fetal hemoglobin, low metabolism, coma states, low body temperature, alkalosis, low body temperature, okay, low acid production, all of them favors left shift. Okay, done. So with this, what we have completed, the conditions where you are going to have the right shift and the conditions where you can expect the left shift, this topic completed. Now if you know this, next what else you should know? The concept of P50, okay, concept of P50. So what is this P50 guys? P50 means the partial pressure at which, P for the partial pressure of oxygen, the partial pressure of oxygen at which 50% of the hemoglobin is saturated. Let me give you the concept. Sir, tell me what is the partial pressure of oxygen in the arterial blood? The partial pressure of oxygen is 100, let's say. Then how much is the hemoglobin percentage saturation? Hemoglobin is 100% saturated, let's say. Partial pressure of oxygen is 100, hemoglobin saturation 100. In the venous blood, the partial pressure of oxygen is 40. Then the hemoglobin saturation is 75%, we know. Now my question to you, when will be the hemoglobin saturation? Will be 50%. At which partial pressure? The partial pressure at which the hemoglobin saturation is 50% in a normal individual. So the answer will be 27 mmHg. Okay, 27 mmHg. So at this partial pressure, okay, the hemoglobin saturation is 50. So simple logic, right? Our concept, see, higher the partial pressure, higher saturation. Lower the partial pressure, lower saturation. So in a normal person, when do you think, in a normal person, when do you think the hemoglobin will become 50% saturated? In a normal person, you have to bring the partial pressure to reduce it to 27 mmHg. So if you decrease this much partial pressure, only then hemoglobin will become 50% saturated. Okay, that is what I am showing here. Guys, look, this is the P50 line. Okay, this is the P50 line. Okay, let me erase. Okay, so concentrate on this line which is called as a P50. Now tell me, how much is the hemoglobin saturation? 50%. See, in a normal individual, at which partial pressure? Whenever the partial pressure is 27 mmHg, whenever the partial pressure is 27 mmHg, in a normal individual, the hemoglobin saturation will become 50%. Now, you have to tell me, what happened to the P50 value in right shift and what happened to the P50 value in left shift? See, in a right shifted curve, tell me, what happened to the P50 value? Now the P50 value is more. And in a left shifted curve, what happened to the P50 value? P50 value is less. Okay, so always remember, see, what happens in a right shifted curve, the P50 value is more. In left shifted curves, the P50 value is less. Okay, less left shift, less P50 value, left shift. Okay, so what is the understanding here? See, the understanding is something like this. See, in a right shifted curve, okay, at 40 mmHg itself, okay, at 40 mmHg itself, when the partial pressure is 40 mmHg itself, hemoglobin is becoming 50% saturated. But in a normal person, you have to decrease the partial pressure, to 27. Only then hemoglobin is 50% saturated. But in high metabolism conditions, in exercising conditions, okay, at high partial pressures itself, at 40 itself, the hemoglobin is becoming more desaturated, releasing more oxygen, because I have told you what kind of environment is there in the body. So this environment also influences. It's not just the partial pressure, guys. It's also the temperature, it's also the pH, it's also the hypoxia, carbon dioxide levels. They all influences the hemoglobin to release more oxygen. Okay, so with this, what we have completed? We have completed the conditions where there is right shift and the conditions where there is left shift, and the concepts of right shift and left shift, and what is a P50 value. Okay, P50 value increase in which conditions, decrease in which conditions. What else you should know? Guys, you tell me, what is the shape of these curves? How these curves are looking like? Are they straight lines? No, definitely not. They are not a straight line. So these curves are more of a shape. The shape is almost like a S. So yeah, the oxygen hemoglobin curves, they are sigmoid in shape. The curves are sigmoid in shape. Done. Next, look at here. See, at high partial pressure, have I told you, at high partial pressure, hemoglobin loves to bind with the oxygen. Whenever the partial pressure decreases, hemoglobin releases the oxygen. So with this, what we have completed? The whole oxygen hemoglobin association dissociation curves. Okay, right shift, left shift, and P50 value topic completed. Hope the video is helpful. Thank you.